Welcome to part 3 of nursing practice questions and answers about respiratory problems of the adult gland. Now let's start with the first question. The nurse is assessing a client with multiple trauma who is at risk for developing acute respiratory distress syndrome. The nurse will assess for which earliest sign of acute respiratory distress syndrome. So these are the options. Option A, bilateral wheezing. Option B, inspiratory crackles. Option C, intercostal retractions. Option D, increased respiratory rate. The correct answer for this question is option D, increased respiratory rate. Now let's move to the rationale. The earliest detectable sign of acute respiratory distress syndrome is an increased respiratory rate, which can begin from 1 to 96 hours after the initial insult to the body. This is followed by increasing dyspnea, air hunger, retraction of accessory muscles, and cyanosis. Breath sounds may be clear or consist of fine inspiratory crackles or diffuse coarse crackles. Now let's move to the second question. The nurse has conducted discharge teaching with a client diagnosed with tuberculosis who has been receiving medication for 2 weeks. The nurse determines that the client has understood the information if the client makes which statement. So these are the options. Option A, I need to continue medication therapy for 1 month. Option B, I can't shop at the mall for the next 6 months. Option C, I can return to work if a sputum culture comes back negative. Option D, I won't be contagious after 2 to 3 weeks of medication therapy. The correct answer for this question is option D, I won't be contagious after 2 to 3 weeks of medication therapy. Now let's move to the rationale. The client is continuing on medication therapy for up to 12 months depending on the situation. The client generally is considered non-contagious after 2 to 3 weeks of medication therapy. The client is instructed to wear a mask if there will be exposure to crowds until the medication is effective in preventing transmission. The client is allowed to return to work when the results of 3 sputum cultures are negative. Now let's move to the third question. The nurse is preparing to give a bed bath to an immobilized client with tuberculosis. The nurse will wear which items when performing this care? So these are the options. Option A, surgical mask and gloves. Option B, particulate respirator, gown and gloves. Option C, particulate respirator and protective eyewear. Option D, surgical mask, gown and protective eyewear. The correct answer for this question is option B, particulate respirator, gown and gloves. Now let's move to the rationale. The nurse who is in contact with a client with tuberculosis needs to wear an individualized fitted particulate respirator. The nurse also will wear gloves as per standard precautions. The nurse wears a gown when the possibility exists that the clothing could become contaminated, such as when giving a bed bath. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN examination 9th edition.